Okay, so again, the brain is an extremely active organ with continuous demands for nutrients and oxygen, and therefore continuous demand of blood. So here we're going to take a look at the vascular system of the brain. You see the common carotid artery coming up. The common carotid arteries are the big arteries that serve the head. The common carotid artery divides into the external and the internal carotids. You can see that there. The external carotid supplies the face, and the internal carotid supplies the brain. The internal carotid travels up and divides into the ophthalmic artery, which supplies the eye, the anterior cerebral artery, which supplies the frontal and parietal lobes of the brain, and that middle cerebral artery, which supplies the midbrain and lateral surfaces of the cerebral hemispheres. And here we have the circle of Willis, which is kind of that circle of cerebral arteries there in the middle. You'll see the right and left vertebral arteries as they come up and form the big basilar artery there in the middle. And then the vertebral and the basilar arteries supply the spinal cord, the medulla, the pons, and the cerebellum. And then that basilar artery continues to move up and branches into the posterior cerebral artery and the posterior communicating artery. And then further up, you can see the internal carotid coming in and it dividing, and the anterior communicating arteries and the anterior cerebral artery. If you back up just a second down back to the basilar artery, you can see that posterior cerebral artery, and that supplies the occipital lobe and the medial and inferior temporal lobe, as well as the midbrain. So again, these are the really big cerebral arteries that supply blood supply to the brain. So again, when we have a stroke or we have a lack of blood supply for some reason, all the brain tissue downstream may not be getting the blood supply it needs, depending on which artery is being blocked or has hemorrhaged and blown, and where the lack of blood supply is. So if we take another look at the circle of Willis in that middle, hold on. So here is the circle of Willis, making that circle right in the middle. It's the main arterial blood supply to the brain. The circle of Willis is the point where blood is carried by those two internal carotid arteries and the basilar artery system. It's where those arteries come together and redistribute the blood to the anterior, the middle, and the posterior cerebral arteries. So it kind of makes like a circle that you can see there in the middle. It's an anastomosis, right? So there's kind of overflow blood. So this anastomosis allows for collateral circulation, or blood flow could go an alternate route if one route was blocked, right? If one of the arteries was blocked or being pinched by something like a tumor, or being blocked by something like, a blood clot, you have this kind of overlapping system that it's a safety mechanism and allows the brain to get blood from somewhere else in that arterial system. The blood can flow in a different direction and still supply certain blood tissues. But again, if there's, depending on where the blockage is, that anastomosis may not work, right? And if, let's say, the cause of the blood clot or the lack of blood supply is a blood clot like atherosclerosis, chances are you've got atherosclerosis in more than one artery at the same time. So depending on how healthy the other nearby vessels are, that can impact whether or not this anastomosis really is able to kind of make up for that lack of circulation in one area. So when we get a little further away from that circle of Willis, we get to if you start to look at the more distal branches of the cerebral arteries. There still tends to be kind of branching and other anastomoses, but these vessels are smaller, right? And so the kind of the anastomoses are smaller. So this is kind of known as the watershed area of the brain. So the watershed area of the brain is where the anastomoses are at the distal branches of these cerebral arteries. This area is really vulnerable to ischemia or lack of blood supply. Because if you have a lack of blood flow to this watershed area, let's say due to hypotension, let's say there's a lack of blood coming in from a cerebral artery, and so therefore there's decreased blood pressure, right? Because there's less blood coming in because let's say there's a blood clot that would be serving this watershed area. So this hypotension is going to result in decreased blood flow to this area. And, you know, the anastomosis is only effective if there's blood flow coming to it. So again, these more distant vessels are smaller in diameter, right? As the vessels get further away from those large original cerebral vessels, they get smaller and smaller, which means they suffer more when there's a drop in blood flow or blood pressure or both. So they're at greater risk for ischemia and lack of blood flow and therefore damage. So when we talk about disorders of the vascular system, I know you've seen some of these before. You'll see these again when we talk next year in Therex 2. So we have, the first one is a TIA, or a transient ischemic attack. And it's right in the name, transient, meaning it's temporary. So they are medical emergencies. It's a brief loss of blood flow to an area of the brain. So, but then, for some reason, that blood flow is solved, and there's full recovery in 24 to 48 hours for these folks. But they are a medical emergency because about 10 to 30% of folks who suffer a TIA go on to have a regular full-blown stroke within 3 months. So it's kind of a warning shot, I think. TIAs are like a warning shot for the big stroke that might be coming. So it's a big wake-up call for folks to probably make changes in either things like blood pressure meds or diet, or maybe they need a medical intervention, but it's kind of a warning shot. So the next disorder further down is the cerebral vascular accident, which is a CVA or a stroke. This is a loss of blood flow. This is not temporary. This is a loss of blood flow to an area of the brain. They have the neurological deficits to that area persist. So the symptoms of neurological deficit persist, but they become generally stable after a time. So once we know what their symptoms are, unless they have another stroke, the symptoms become generally stable. Two big causes of CVA or stroke would be an infarct, which can be caused by a clot, a blood clot, or an embolus, which is a clot that dislodges and travels to another area and causes that area to lose blood. So that infarct is kind of an obstructed vessel. And then there's tissue death because there's been a lack of blood with the associated oxygen to that area. So infarcts, those infarctions cause about 80% of strokes. Most of those are in that middle cerebral artery. So when we talk about, kind of classic stroke symptoms or the classic stroke syndrome, that middle cerebral artery is the big one because it covers such a huge area on the latter of the cerebral hemispheres. A hemorrhage can also cause a stroke, though. That other 20% of strokes are caused by hemorrhages, which is when the vessel actually blows. This deprives vessels downstream of blood and therefore oxygen. So the tissue and the vessels that those tissues would have supplied with oxygen are now lacking blood, so therefore they're lacking oxygen, so the tissue gets damaged or dies. And then when you have a hemorrhage, you also have all this extra blood now that's out of the vessel that blew, and it's now you have this extravascular blood that's kind of running around and increasing the pressure. So there's a big pool of blood in that place where the hemorrhage was, and that pooled blood increases pressure, causes cell death, and also the secondary impairments from that increased pressure being pushing on the brain tissue. Oh, I gotta go back. Hold on.